Hello and welcome to Medical Dialogues. I'm Dr. Garima Soni. Let's look at today's top medical news. Bengaluru reports highest dengue cases in India, declared epidemic by Karnataka government. With dengue fever cases rising quickly across the state, the Karnataka government has declared it an epidemic. The state government has directed health officials to take strong actions to stop the spread of dengue in Bengaluru and other towns in the state. According to health department data, Karnataka has had 25,408 cases of dengue and 12 deaths. Bengaluru has the highest number with over 11,000 cases and 3 deaths. Other places like Mandya, Hassan, Mysuru and Kalaburgi also have many cases. 20-fold higher increase of sudden cardiac death between 30 and 40 years with type 1 diabetes. ESC Congress 2024. Data from Danish study presented at European Society of Cardiology Congress 2024 reveals that patients with either type of diabetes, particularly type 1, experience higher rates of sudden cardiac death across all age groups. This increased risk highlights the need for better risk assessment for these individuals. Their latest study investigates the impact of sudden cardiac death on people with diabetes within the general population. It also explores how much life expectancy is reduced due to the sudden cardiac death in individuals with both type 1 and type 2 diabetes. The researchers used 2010 data from the entire Danish population, which includes about 5.5 million people. They found 6,851 cases of sudden cardiac death and matched these cases with individuals who had type 1 and type 2 diabetes based on prescription records. They then determined the loss of life years for each group of diabetes diagnosis. New findings. Mobile phone use and increased risk of cardiovascular diseases. A new study has found that regular mobile phone use was positively associated with incident cardiovascular diseases risk, especially in current smokers and individuals with diabetes. In addition, this association was partly attributed to poor sleep, psychological distress, and neuroticism. The article details the result of this large-scale prospective cohort study. The study included 4,44,027 individuals from the UK Biobank without a history of cardiovascular diseases who self-reported on the frequency of their mobile phone use from 2006 to 2010. New study highlights key indicators for dentists to identify sleep apnea. In the research review published in the Journal of American Dental Association, Rutgers health researchers identified dentists as an unexpected player in the battle against life-threatening sleep disorders. A patient dozes off in a dental chair despite the anxiety of an impending procedure, a seemingly unremarkable act but for dentists worst in the latest sleep research. This red flag hints a life-threatening condition. The review suggests dental professionals have unique opportunities to screen for conditions such as obstructive sleep apnea, a disorder that affects millions of Americans and is linked to a serious health risk, including cardiovascular disease and neurodegeneration. It also challenges dentists to look beyond teeth and gums to the broader landscape of the patient health. Sleep disorders such as obstructive sleep apnea affect more than half of the people at some point in their lives. Many cases go undiagnosed, but dentists can play an important role in reducing those numbers. The review outlines several key indicators that dental clinicians should look for during examinations, include enlarged jaw muscles, scalloped tongue edges, white lines on the cheeks, restricted visibility of the throat, dental wear patterns, and tiny cracks on the teeth. False positive mammograms may deter women from future screenings, research finds. A major new study led by the UC Davis Comprehensive Cancer Center has found that women who received a false positive result that required additional imaging or biopsy were less likely to return for the follow-up screening. The research was published in the Annals of Internal Medicine, analyzed data on more than 3.5 million screening mammograms nationwide performed between 2005 to 2017 on over 1 million patients aged 40 to 73. The study found that 77% of the women with a negative result from a mammogram returned for subsequent screening, but this percentage dropped to 61% after a false positive finding, requiring another mammogram in 6 months to confirm the result, and 67% if a biopsy was recommended. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.